How are you feeling?
Kind of sad.
Yeah. I wrote out a current baby bump.
You wrote it out?
Mm-hmm.
What did you say?
0 weeks pregnant. Bunch of stuff on there. I took a picture, but I didn't want to show you because I just thought it'd make the whole thing like this sad, and we're gonna use it. So I don't want it to be sad.
Put everything away for right now.
Hey, what's up? Welcome back to my channel. I'm Sarah, and in this video we are going to be getting a call from the fertility clinic about some news that we're going to find out. We know that it is negative. It's bad news because of the ultrasound, and I'm sure many of you have seen that already, the part 2. I recorded the conversation between the fertility clinic and also Jenna and I. So yeah, just listen to that, and that's what this video is about.
So Dr. Amato reviewed your ultrasound, and there is no change from the previous ultrasound.
Yeah.
Okay, so at this time there's no fetal pole or yolk sac noted within the gestational sac.
Yeah.
Okay, so I'm sorry that this doesn't look like it's going to be an ongoing pregnancy at this point.
Yeah.
My apologies.
It's okay.
Her recommendation for now is for you to stop your supportive medications.
Yeah.
And then touch base on Friday.
Okay.
Jen will be back in the office tomorrow, and she'll be in on Friday. So we'll give you a call to see if you've started bleeding on your own yet.
Okay.
After stopping the medication. If you haven't started to bleed and pass things naturally on your own, she may recommend taking medications to help that happen.
So I don't really want to do that. I probably would rather schedule a DNC.
Okay, so that's
I'll wait to see if it happens.
So that's fine. So you can always schedule a DNC too, but we at least like to have you stop medications and allow your body a little bit of time.
I did have a question about, I'm sure everyone asks, how long until we can do another transfer? How long does my uterus need to reboot?
Well, we need to follow your level down to baseline. So,
HCG needs to be 0?
Yep.
Okay.
Yep.
So
and typically after that, then you can potentially restart pills. Sometimes they like you to have 1 month of bleed, one cycle on your own.
Okay.
And then with the next period. But, the process of following that level down, depending upon if you start passing naturally on your own or if you have a DNC with your local provider, even with the DNC, it still takes some time for that level to go down.
Can I ask you just a side note question?
Sure.
So my wife and I already had an appointment with Amato to do a second egg retrieval coming up here, and we wanted to know, can we spin the sperm because we're planning, we want to have a girl first, just because of, I don't know, that's just what we were trying to do. We want to have a boy later. So we were hoping that, can you separate the sperm?
We don't do that here. We can do screening. You can do genetic screening on the embryos, which would, doing that would provide you information on the gender.
I'm just wondering. Yeah. So you don't separate the sperm?
Yeah.
Okay. That's good to know.
That's good. Yeah.
Sorry.
That's okay. We'll just do.
We're just wondering.
Okay. Yeah, of course. So I will send that Dr. Amato a note, just to see if she has any additional information just regarding, your uterus healing after and the time frame of the next transfer cycle. And then I'll put a mock telephone call appointment for us to check in with you on Friday.
Okay.
I'll send you some information via my chart with some bleeding precautions. So, it'll probably, what you'll experience will be kind of, a heavy period. Okay, but if you're soaking a pad an hour, or start becoming lightheaded, dizzy, sharp shooting pain, those sorts of things, of course you need to seek emergent care. Okay, so all right. So I'll send that to you in my chart just for you to
Thank you, Katie.
view as well.
Thanks.
Thank you, Katie.
Yeah, you're welcome. We'll be in touch. We'll follow up on Friday. I'll send you that information in my chart just for you to review.
You're so sweet, Jen. That was... Sucks. I know, but I have a good feeling about I know.
I'm
You're
so I'm
optimistic,
too
you're hopeful.
optimistic. When I go through hard things, I'm
Bounce back.
optimistic. I bounce back real quick. I used to not back then, but that's because, you know, like going through sexual assault, that was very hard for me. The wrong way was drinking and smoking and sleeping around.
You coped in that manner.
I coped in a bad way. I learned how to cope a better way when bad
Might
things
have
happen.
needed to get through it at that time.
Maybe, I don't know. Well, so the nurse called us, and I did not know actually that they were gonna call. Maybe you did. Maybe you told me. It's because I was so like out of it, like so sad about this. But yeah, you know, it sucks. You know, a loss is never, you know, good news, right? But I think that there will be a good reason for this. Eventually we'll see it. Right now we don't. The higher power knows that we have some really good things coming. We have some good things coming. I mean, when I think about this, then this means that when Jenna does get pregnant here next time, her and I, when I'm in school, you know, I won't be in school. I probably will be end of graduating, which this is a really good thing. So I'm looking at all the positives, you know, around, even though it's a really sad thing. I might, you know, cry again and all that. It just doesn't help doing all that, but it's good to, you know, relieve it. I did talk to a couple friends. Some of them I didn't reach out to. I'm just waiting for people to ask how I'm doing, but I don't know. I just talked to people who have gone through it. It's definitely weird. It's like we're missing somebody. Like we're missing something. You know, it sucks that, you know, we have to go through this whole miscarriage thing. I've lost a baby already in my past. That was really hard. And I have chronic pain, and I deal with depression and anxiety. You just cannot give up. And I think, you know, when the next baby, the baby that is meant to be Jenna and mine, you know, I'll be done with school, and I want to work out a lot more. I want to be like, have less pain. And look at what Nika's doing. She's trying to eat the cord. Let's not do that now. And
Nika, thank you for saving my cord.
yeah, I did. You know, we don't understand right now why this is happening, but I will see it. I will. In about 6 months, I will be like, why didn't I not see that? Okay, I get it. It still sucks, right? Bad things happen. But there's a lot of good things that are happening too. Just gotta take the good with the bad. And you have to remember that. Anything else you want to say?
No, just that we're gonna keep moving forward because we're building a family, because we know we're good parents.
Yeah, we will. We will. It's gonna happen. Just give it some time. I would love to have some twin girls.